pleasure to have you join us today on the program Healthy Living. I'm Adesuwa Usa-Uwage. And without much ado, let's quickly welcome our guest before we tell you what we're going to do today. So, she said beside me is Dr. Jite Okaka. She's a consultant nephrologist. Happy to have you join us today, Dr. Jite. And then the gentleman amongst us is Dr. Oji Ozegbe. He's also a consultant nephrologist. Happy to have you join us.
Thank you.
And seated a bit far away from me is Dr. Mrs. Idoye Keme. She's a pediatric nephrologist. Happy to have you join us today.
You're welcome.
Okay, I'm particularly happy that I have this wonderful set of persons in the studio today because we want to talk about the kidney. It's World Kidney Day in a couple of days, and we are going to look at quite a number of health issues in focus today. If you look around you, maybe out of 100 persons, you find out that 20, 30 are down with kidney problems. How do they get that? How do they get to that point? A lot of us don't know, because by the time they know that they have kidney problems, it would have been almost too late. So, gentlemen and ladies, kidney problem is what we're looking at today. So talk to us. Let's look at the World Kidney Day first before we go into what we have to do today. So tell us why we're celebrating World Kidney Day. Now, why should we celebrate World Kidney Day?
So now, the second Thursday in March every year is celebrated as World Kidney Day. And we celebrate World Kidney Day because we want to increase our awareness on kidney disease, about how people can prevent having kidney disease, and those who have kidney disease, what help they need to keep the kidneys working for longer, and then what are the common causes. So we want to increase our awareness.
Okay.
That is why we celebrate World Kidney Day.
Okay, fantastic. Okay, Dr. OJ, with all the awareness we've been creating, with all the talks, television talk, radio talk, even road walk and all of that, it seems that the number of patients that are down with this disease is on the increase. Why is this so? Is it that people are not listening to the awareness, or people don't know what to do, or people don't know how to go about it?
You are right. The number of kidney cases are on the increase. They're not simply on the increase because more are being created, which could be the truth, but more are beginning to appear in health centers. So which means we're actually catching more than we used to catch before.
More than we used to.
The number of people involved with kidney problems, that have kidney problems, is enormous. It's a huge number of people. The awareness is yielding fruit, but you see, you cannot expect to have all the fruit in one day. Gradually, it is beginning to dent the lack of knowledge about kidney disorders. Okay. Even the primary cause of kidney disorders, many people are not aware that they even have those problems. Okay. Talk less of the kidney problems itself. Okay. Yet you are doing well.
Okay, you think we are doing well?
I think so. I really think so.
Okay, I'll go to Dr. Mrs. Idoye Keme. She's a pediatric nephrologist. You know, it's hard to believe that, as a pediatrician, you know, it's hard to believe that children do come down with kidney problems. Can you talk to us about this?
Okay, thank you very much. The kidney problem in children is a bit unique because even from birth, they already have this problem. And that makes it a bit different from the adults. We know that due to the development in the mother's womb, that some abnormalities could take place. And right from inception, the children already have malfunctioning kidneys. So that's one special way that the kidney problems can occur in children, which is different from the adults. Okay. The other thing about, I know that most people will say, how come kidney problem in children? Yes, there are many things that could cause them. Infections are one common things in our environment.
Infections from the mom?
No, infection even from the atmosphere. For example, the urinary tract. If a child has a urinary tract infection that is not properly cared for, can eventually lead to kidney problem. Or if the person is prone to certain conditions, it could trigger that condition. Infection could trigger that condition and bring about certain kidney problems. So these are the ways that it differs in children.
Okay, before a child is born, is it not possible during antenatal to check all of this to notice that such a thing is happening with that child?
Okay. Presently now, yes, antenatally through ultrasound, we could actually detect those congenital problems.
Okay.
But there's nothing much we could do in utero when the baby is already being formed. So it is only after the birth.
Nothing absolutely.
Nothing absolutely. Overseas they have tried to do certain things.
Good. I was going to go to that because I saw one on TV.
But they've not found it to be very beneficial. Instead, it might even be harmful to both the baby and the mother doing those special surgeries in utero.
Okay.
Yes.
All right. I'll come back to you for more questions. Dr. Jite, now let's look at the life of an adult. What should one look at? Because some persons have said that they didn't know, there were no signs, there were no symptoms. So what are the signs and symptoms one should look out for?
Now, before I mention the signs and symptoms of kidney disease, I want to mention here that kidney disease can be asymptomatic up until the very end. It can happen. It can be that the symptoms will be so subtle that the person will not realize until they are now in need of dialysis. But commonly, if we want to talk about the symptoms of kidney disease, we can easily understand them when we consider what the kidneys do for us. The kidneys produce urine. We excrete waste products through urine. So one of the complaints somebody with kidney disease will have is that, I'm not passing out enough urine. And somebody who is not passing enough urine, we know urine is mainly water, it means they will have body swelling. So body swelling, one of the symptoms of kidney disease. Swelling in the face, worse in the mornings. As the day goes by, it will look like, the swelling is going down. So swelling in the face, swelling in the legs, generalized swelling of the body, that is one of the symptoms. Then since we know the kidney produces urine, abnormalities in the urine. For example, the urine foams too much. What we mean by foamy urine or frothy urine is that we know that while passing urine, some air bubbles can be there. But once you finish passing, if you wait for a few seconds, you should see that those bubbles should settle. But if that urine is frothy, those bubbles won't settle. You will see that the urine is foamy. Foamy as if you have tried to pour beer into a glass. It can be that bad, that frothy. So if you have urine that's frothy like that, you know that something may be wrong. Now, foamy urine or frothy urine indicates that the kidney is leaking protein. Normally, the kidney shouldn't leak as much protein as that would be so obvious that the urine is frothy. Another abnormality is blood in urine. Blood in urine must always be investigated. It should not be wished away because it is a symptom that something has gone wrong with the kidney or the urinary tract. So body swelling, blood in the urine, frothy urine. Now, even one of the symptoms of kidney failure is weakness, generalized weakness. And the thing is that sometimes when people have symptoms of being unwell, they keep explaining it away. Or maybe I'm working too hard, or maybe I'm stressed. Why not go for a checkup? Because one of the complaints that we have is general weakness, and that's because the kidney helps us to form blood. So when the blood is low, you'll be weak. If the blood is low, you can't carry out your normal activities without feeling tired. So unexplained tiredness, changes in the urine like blood, frothiness, then body swelling. Those are symptoms that make you wonder, is there something wrong with the kidneys?
Okay, let me come to you, sir. While Dr. GT was talking, I'm all of a sudden afraid now because of all the things you have said. Okay, while Dr. GT was talking, she talked about somebody being asymptomatic, that sometimes you don't even have signs and symptoms. Please, I want you to talk to us about this one, because somebody may just be down with kidney problems and would not know. Apart from everything that she has said, what else can one do?
The fear you expressed is very genuine. Actually, a lot of people do not know that they have kidney disease at all. And really, when they come, it's usually gone very far.
Very far.
What we'd like to tell people is that, first, There is even nothing wrong with you doing a checkup. Probably won't cost 1,000 or 2,000 naira to do a basic checkup.
It's not in our culture to.
It's not in our culture to. That's why we are having.
Go to hospital and say,
then go and
let
start.
me do test. I'm not sick. I'm okay.
That's one. The second thing is that there are things that predispose somebody to having kidney disease.
Okay.
Once you have any of these things, it is compulsory that you assume that you may as well have the kidney disease as well. One of the most common one in this environment is hypertension. A lot of people are hypertensive. Another one is diabetes. A lot of people have diabetes.
Yes.
Now, another one is that she mentioned that when you have urinary froth or blood in your urine, it could signify kidney disease. She's very right. But at times, the blood in urine does not really show up as blood. The urine may be just brown, Coca-Cola colored or tea colored urine. Okay. And that could signify that there is already blood in that urine. Okay. So we should develop a culture of checkup. Many times we don't check ourselves up. We remember to check up our cars and to do routine servicing of vehicles.
To do our hair,
but thank you very much. You've hit the nail on the head. So it's essential that we also get into that habit of being able to do a checkup whenever any of these things come. Unexplained weakness, like she said, it's something that you should check up. You're getting tired. There are sometimes you lose appetite. Many times some people have kidney disease, and it could be that they increasingly find out that they don't sleep as well as they should sleep, and they don't eat as well. The food doesn't taste as nice as it should.
Okay.
Now, the good news is this. If you do an early checkup, a lot can be done before it goes right down to frank kidney failure. It is that vital window we want to be able to close up so that a lot of people will benefit from it. Because in the early stages of kidney disease, if you are caught on time, you do not necessarily have to go to full-blown kidney disease. Okay. That is why we are here creating this awareness. Thank you very much. Yes. Yes.
Okay, Madam, for children, I'm particularly worried about children because as a mother, we see our kids every day. We're happy to have them. They play around you, and all of a sudden, a child is down. And most parents find it difficult to go to the hospital, particularly government hospitals where you have, the team of professionals at hand. And then we just wish a lot of things away. We do PCM, we do tepisponging, we just do quite a number of things and then wish some away and say, this child will be better. And then the next thing we pray and everything is settled as far as we're concerned. But when that child is down, we start running from pillar to post. Please talk to that mother today. What to look out for in her child or his child and how to go about it so that that child does not eventually come down with kidney failure.
Okay. So thank you very much for that. Like I said, that kidney problems in children is a bit different from adults.
Yes, you did say that it's unique.
Congenital, meaning that some of them are from birth.
Yeah.
So, like we likely discussed, nowadays we can diagnose some through ultrasound, and of course your doctor will tell you what to do, so you start early, and that will help. But one thing I always tell mothers, especially mothers who have male children, please, before you leave the hospital, ensure that you see that first urine of your child, of your son.
Okay.
I know these days we all use Pampers.
And all of
it will be proper for you to expose the child and see that jetting of the urine. Because if that is not safe, it must jet, yes. Especially when the child is actually circumcised. Or on the first day you may see a jet, but it's clearer when the child is a male child is circumcised. So when that does not happen, it shows that there is a blockage in the flow of the urine.
Okay.
And that is something that can be done early. Because if it's not done early, it's going to cause further damage to the main kidney. It is the tract that is blocked, not necessarily the kidney now. But with back pressure, the kidney will be damaged. But this can be known early and action should be taken early. The reason I'm saying this, we see children 9 years, 10 years coming with this problem. By that time, we cannot offer them anything. We are now talking of transplantation. which is a very big word that every one of us are usually scared of. So please, mothers, once you have a male child, make sure on the day, at least before you leave the hospital, let somebody see that jetting of urine. That gives us that the child has a good stream, a good stream. Now, the other thing, just like my colleague
what
said,
about in female children?
in female children, that condition does not occur. There are some other obstructive conditions that do occur.
Okay.
But they are not as obvious as in the male. What I mean, causing obstruction. So what those ones can be seen on ultrasound, or the mother may notice a mass, a swelling. When she's bathing the baby, you notice that, oh, one side looks bigger than the other in the abdomen. That is the sign that probably the kidney on one side is blocked, and so it's not flowing well. So it's getting bigger inside the body. So that is a very common sign, more in a female than even in a male. So that is one way to also know about it. The other things my colleague have mentioned, yes, by the time the children are now having advanced disease, they will have all those swelling of the body, frothy urine, anemia, all those paleness of the body can also be seen even in children. But we don't want them to get to that stage. Now, if your child is beginning to have, in the morning, the face swell, in the evening, do not wait for the whole body to swell. Is this wishing away? Oh, okay, because yesterday the face was swollen, you say, oh, there's a lot of stories.
Maybe
they will come and tell
rice
us
for dinner.
that he ate rice for dinner.
I've heard that
is
too.
not, I'm happy you are saying it. That is not true. There's a problem. It's a kidney problem, and it needs to be addressed. So don't wish it away. Come to the hospital. Let's investigate this child and start therapy early.
Okay, we're going to take a very short break here. When we come back, we'll continue with the program. Stay with us. A pleasure to have you join us again on the program Healthy Living on ITV. I see have with me in the studios Dr. G.T. Okaka, Dr. Mrs. Idua, and of course Dr. Oji Oziegbe. And we are here talking about you and your kidney and that of your kids. Okay, let me come to you now, Dr. Oziegbe, Dr. Idua, before we'll take calls. You can start calling us now, 052-290-573. That number is going to be on your screen shortly. Give us a call. When you're calling, reduce your audio level on your television set so that we can hear you. If the audio level on your television set is interfering, then we may just have to let you go and pick other calls. Okay, ma'am, you know, these days, our kids is a lot of things. As parents, we don't have time to do the needful most often the time in the kitchen. And so you see that kids go about with junk food. And of course, genetically modified foods and all of that. So these things have effect on our children's kidney. And of course, soft drinks. We do a lot of soft drinks. You're packing a child's bag. There must be one form of sweet drink or the other. Do we have to be careful about all of these? And then we have all sort of noodles with all sort of, what do you call it now? Seasoning inside. You know, please.
Yes,
I need you to talk to us about this.
I'm quite happy that you have brought up this very interesting
Yeah, because I'm also
topic.
Afraid. We do that
Yes.
a lot.
Over the years, our diet has actually changed. In Africa, in Nigeria, it's really obvious. We know that because parents really don't have enough time, and both parents now are actually working, it has actually changed the way we used to eat as families. But I want us to know that yes, we don't have direct data, but we suspect that is one of the reasons we are having high levels of not just kidney disease, many other diseases. And some of them in children it might not really be a problem, but eventually it begins to show in young adults. For example, we are now having young adults having kidney problems, even kidney failure.
Total failure.
Yes, total failure. My colleagues can testify to that. So it's a cumulative thing. So it's not as per, because a child eats something today and by tomorrow morning it will definitely have a kidney problem. But obviously these things are not what it should be, and yes, they are contributing.
So we have to be
very careful, yes.
Okay, Dr. Chite told us quite a number of things. Dr. Zebio, you've also told us quite a number of things. Now, in adults, we do a lot of sport drinks. There are so many sport drinks because the other time we talked, we also said that lifestyle is also a problem when it comes to kidney failure and kidney disease. Please, you will tell us what we should do, how to take care of our kidneys, what to run away from, and what not to do. Just talk to us about diet, but we'll need to pick this call. Hello, caller. Hello. 052. Hello. Okay, while we're waiting for that call, doctor, please talk to us.
Okay, now we talked about conditions that you may have that will predispose you to kidney disease.
Okay,
we mentioned.
Hello, caller. Good afternoon.
Hello.
Good afternoon. Tell us your name and where you're calling from.
Good afternoon.
Go ahead. Your name and where you're calling from.
I was interested in this talking just now, but I want to ask the question, how does it affect the lung after it cured?
I didn't get that, sir.
I said, tuberculosis, the doctor said. I will say it affects lung. So I said, how does it affect, how can it be cured?
Tuberculosis?
Yes.
Okay. We'll find a way of treating that topic for your sake. We're talking about the kidney today. Thank you for calling. All right, doctor.
Now, we had mentioned earlier that you can have some conditions that will predispose you to kidney disease. I will mention hypertension and diabetes.
Yes.
But now I want to talk about things that one may be doing that can hurt the kidneys in the long run.
Okay.
Because we have talked about diet now, I'm mentioning diet. Now, indiscriminate use of painkillers is one thing that can hurt the kidney over a long period. Some people, yes, some people just go to the patent medicine store and they say, please give me that cocktail for body pains. And they are given several pills to take at once that will definitely just kill the pain. But certain painkillers are harmful to the kidneys. So it is not good practice to do that. When you do that for a long time, it can cause kidney disease and lead to failure. Now, talking about drugs, our youth these days, they get involved in the use of hard drugs a lot. And like my colleague earlier mentioned, yes, we have young adults.
Okay, Dr.
Hello.
Hello, caller.
Good afternoon, sir.
Good afternoon. Tell us your name, ask your question sharply.
I'm innocent.
All right, Innocent, go ahead. Reduce the audio level on your television set, please. Okay, go ahead. Oh, I didn't say leave the line. I just said reduce the audio level on your TV set. Please, let's try and adhere to this rule. It's very simple. Move away from your TV. Okay, doctor.
So these days we have many youth that get involved in drug abuse. They take hard drugs. Those drugs like cocaine, heroin, amphetamine, they damage the kidneys. So we have young people coming up with kidney disease, kidney failure. By the time you go in depth into the history, discover that they've been using drugs. So that's another thing. Now, salt is not our friend, I always say it. If we take a lot of salt in our diet, it encourages hypertension and eventually kidney disease. And we should remember that when we say we're cooking with salt, a lot of those seasonings are very high. They have a very high sodium content as well. So when you're adding salt, you have used all those seasonings, you make the food too salty. And salt is not our friend at all. It's not a friend to the kidneys. So salt intake we should cut down, and then we should be moderate in the use of all these seasonings. They were in excess. In fact, we're trying to make the food very sweet, but we'll be hurting the body. And then the use of drugs. Then another thing I must mention here is this use of skin bleaching agents.
And some parents
In fact,
use bleaching agents on their children.
Yes.
It is really rampant now that I tell people that the color of your skin You determine the color of your skin. You determine whether you want to be dark or you want to be white or you want to be fair. Because there are so many agents people use these days to whiten. And the chemicals in those whitening agents, they are not kidney friendly. Now, people will say, oh, this lady has been using skin lightening cream for 20 years, nothing is wrong with her. But you don't both have the same genetic makeup. Maybe this person's genetic makeup has already predisposed the person to having kidney disease. Now, using such agents in an additional insult.
Hello, caller. Good afternoon. Hello, I can hear you. Hello?
Good afternoon.
Yes, tell us your name and ask your question.
Hello? Hello?
Tell us your name and ask your question, please. Good afternoon. Your TV is still very loud. I don't know why you can't hear me. Hello, good afternoon.
Hello, good afternoon.
Yes, please tell us your name and ask your question.
Please, I'm calling from here.
Okay, go ahead with your question.
Please, I just expect that you your program right now, okay? I want to know what are the causes and prevention of this kidney failure. Sorry?
Okay, just listen to the watch the program to the end. You will get all of this.
Thank you very much.
You're welcome.
So, now the use of bleaching agents is so rampant now. And the chemicals in these agents, some of them are harmful to the kidney.
Okay.
We know the popular hydroquinone, but now you have things like kojic acid, azelaic acid. So,
And there are tablets they swallow.
tablets they swallow, injections they take to whiten the skin and all that. Some people will come down with kidney disease many years after from using these agents. Yeah. So, like I said, your genetic makeup is different from the next person's one. Some people already have problems in their genes so that they are more predisposed to developing kidney disease. Now, using such agents or using hard drugs is now an additional insult that will bring out the kidney disease. So don't say, oh, this person has been using this agent for 20, 30 years, she's elderly now, nothing happened to her, I can use it. People are different. So the way we can prevent kidney disease, all these things that we know can be harmful to the kidney, let's avoid them. What the kidney needs, the kidney wants us to drink a lot of water.
Okay.
Drink enough water.
Even in children, madam?
Yes, please.
Drink enough
Lots
water.
of water.
And one way you will know that you've taken enough water is that your urine is clear. Anytime you go and pass urine and your urine looks concentrated and dark, it tells you, look, you've not had enough water today. So let that be the guide. Let's take enough water. Water is the best beverage, not sugary drinks. It's just that to be boring to just be drinking only water. So have that in mind and let water be a friend. Then let's avoid things that can harm the kidneys. Then if we know we have those medical conditions like hypertension and diabetes that we know can lead to kidney disease, make sure you have a check at least once in a year. Or anytime you feel unwell, also go for a check.
Okay, Dr. Ojuzegbe, I know you want to add to what Dr. Kakajo said.
Yes,
Somebody asked a while ago, prevention and treatment and all of that.
That was a very smart question. You see, when it comes to kidney disease, prevention is the key. It's all right for us in the studio to talk about kidney disease, but until you go out there to the teaching hospital and see one patient with kidney disease before you realize the enormity of it. To transplant now in some hospitals, apart from you providing the donor, if you get a donor, you have to part with up to 20 million naira. That does not mean you will stop medication for the rest of your life. So prevention is very important. Let me quickly add something we haven't added, because I'm a man. Yes. If you're a man and you have reached 50 years and above, go check your prostate gland.
Okay, so aging has got something to do with it too.
Yes, well, most men don't want to be called aging at 50 years or at 60.
That's the 40, yeah.
Yes, but you need to go check your prostate gland because it can cause obstruction of urine flow. And then that gradually will begin to cause problems with your kidneys. So apart from those who are hypertensive, those who are diabetic, those who have who have had sore throat and other things in childhood. Every man that has crossed the age of 50, 55 years on a regular basis should go and check.
Let's round up now. Ma'am, bleaching cream for children. I see quite a lot of children with sunburn already. You know, and they say, no, you know, I don't know what they are trying to tone, or maybe the child has rashes or something. Then you see sunburn already, an indication that bleaching agent is being applied on that child's body. Please, in 30 seconds, can you just advise this set of women?
Yes, I would want to discourage bleaching agents completely. Like we have heard, they are actually dangerous to our, as they are dangerous to our skin, so also they are dangerous to the kidney. But the kidney is the one that is eventually going to bear the brunt as the child grows. You can imagine that for a very small child, 5 years old, you're already using bleaching agents. Even if for an adult, he bleaches from maybe his 20s to 50s, and it might take that for you to see the kidney disease. Yeah. So, but if you start from 5 years to start bleaching a child, it means that younger, they are going to have this problem. I really don't understand why this has become a problem in our society. It was something that was on the downward trend, but suddenly in this present millennium, well, Generation Z, as they call it, I think it has now exploded, and really is scary to us, because we are looking at more and more kidney cases staring us in the future.
All right, doctors, we're not going to end here. We'll find another day to do this issue. We're not just going to restrict it to World Kidney Day celebration. We will find time to come on air again to talk about the kidney, because the prevalence is very much so on the high side. Thank you, doctors, for finding time to be with us in the studio. Thank you, ma'am, especially for talking about children and for talking to those, my sisters out there, who would not want to ordinarily listen to good advice, but now you're hearing from an expert. I hope and believe that you will take good counsel. Thank you very much for finding time to be with us in the studio. And of course, you're blessed amongst women.
Thank you. Thank you very much
for watching too. We'll see you again next